urge you to visit our website at togetherwomenrise.org for more information and ways to get involved. It's time now to turn to our first of tonight's speakers. Each month, Together Women Rise features a project that addresses one of many challenges faced by women and girls in low-income countries in the global South. We award these projects a featured grant between $35,000 and $50,000. And together at this monthly webinar and at chapters all across the United States, we learn about the country, the challenges, and how the project will help women and girls and global gender equality. This month, we are partnering with Arogya World. This project aims to improve health behaviors known to prevent non-communicable diseases such as diabetes, heart disease, cancer, and chronic lung disease, and to improve the lifelong nutrition status of rural adolescent girls. First, we're going to play a short video about the project, and then I'll introduce our guest speaker from Arogya World.
The sound is not on.
I think it comes on.
We work at Arogya World in diabetes prevention in India, and we promote prevention through healthy living because we know 80% of type 2 diabetes is preventable through 3 lifestyle changes. We must eat right, exercise, and avoid tobacco, because these lifestyle changes are best developed in adolescence. We have a tool called My Thali, with which we are trying to change the way India eats. We adapted that for, originally developed it for urban women and are promoting it aggressively using social media. But we also adapted it for rural adolescent girls in an aspirational comic book type conversation, which teaches girls why eating right is so important for them. In this study, we will be integrating it with our schools program that already teaches healthy living to 11, 12, 13-year-olds. And we'll be adding this extra modules that we'll develop as a full sort of formal intervention that can teach the basics of eating right using the My Thali tool adapted for rural adolescent girls. This is the deployment project. This is finding a way to integrate it with the schools program and also to deliver it to school girls in school and measure the impact.
Adolescents in India suffer from the triple burden of malnutrition. That is, they're undernourished. At the same time, there is hidden hunger where they lack a few essential nutrients, and a few percentage now is also becoming overweight and obese. So the numbers are very alarming. There's also a rise in the consumption of unhealthy food, especially the junk food, which is high in sugar, fat, and salt. At the same time, there is a decline in the consumption of fruits and vegetables, dairy, and protein sources. The WHO report also states that 3 out of 4 teens, that is 75% of the adolescents, are inactive. So unhealthy eating along with physical inactivity and tobacco usage increases their chances and make them more prone to chronic degenerative disorders like diabetes, cardiovascular diseases, and cancer. 2/3 of India's population is still rural. Yeah. And rural adolescent girls especially are hard hit with both hidden hunger, that is anemia is very high, the prevalence is around 50%. 30% of the adolescents are also stunted, so undernutrition is also very high, and they also show signs of vitamin A and vitamin D deficiency. Also, early marriages, the percentage or the prevalence of early marriage in rural areas is high. That is, the girls are married off before the age of 18. And there is a high school dropout rate as well. So these adolescent girls become more vulnerable, and if their nutritional demands are not met, and if they go into early pregnancy, then there are chances that they would give birth to low birth weight babies who in the later decades when the child grows up are more prone to risk of diabetes and cardiovascular diseases and cancers.
मैंने अपने जीवन में खुद देखा है कि कैसे सुधार हो रहा है मेरे स्वास्थ्य पर, और जैसे कि हम देखें पोषक तत्व कैसे ले रहे हैं, या फिर बाहर का जंक फूड भी हम नहीं खा रहे हैं। हम देखते हैं कि बाहर का जंक फूड बहुत ही हार्मफुल है और हमारे स्वास्थ्य पर प्रतिकूल प्रभाव है। इसलिए हम दूसरे बच्चों को भी सही सहायता वो परामर्श देंगे कि वो भी इस स्कूल में सहभागी रहे।
This project stands out for two reasons. One, it is actually giving voice and agency to girls and their nutritional needs. This is one of the programs that, what's noteworthy about it is the fact that it is addressing nutritional needs of young adolescent girls. And the second is that, if we prevent, if we can teach these girls who are 13 and 14 years old to eat right, not only will they have a healthy and safe pregnancy once they get married, but they will also be able to set that child up who's born to them for a lifetime of health.
Thank you. That was very powerful. Tonight, we are pleased to have with us Dr. Lani Salagram, founder and CEO of Arogya World. Under her leadership, Arogya World designs and implements scalable, science-based diabetes prevention programs in Indian schools, workplaces, and the community. As a tireless advocate for prevention of non-communicable diseases, Nalini, I'm sorry, I said that wrong. Nalini leverages public-private partnerships and global platforms to improve the world we live in. Arogya World, which recently won the United Nations Interagency Task Force and the WHO Special Program on Primary Healthcare Award, has made and fulfilled 3 Clinton Global Initiative commitments and a United Nations Every Woman, Every Child commitment. Her story and that of Arogya World has also been highlighted in a book, The Healthcare Game Changers. In 2001, on her watch, Arogya World was chosen to be part of the Google AI for Special Good. A few years earlier, was named finalist for the Peter F. Drucker Award for Nonprofit Innovation. Nalini has a PhD in biochemistry from the Indian Institute of Science in Bangalore. She serves on the Dean's Council at the Roland School of Public Health at Emory University and is active with India Sphora, the India Philanthropy Alliance, and the Global Center for Healthy Workplaces. She is based in Atlanta. Welcome, Nalini.
Thank you so much to all the women, and to Barbara, thank you for your support. Together Women Rise's support for Arogya World is really something special for us. This is sort of our first major girls project, so we're so happy to be supported by a group of women who all care for women and girls. Your mission is fabulous. Your efforts are fabulous. So I really commend you for keeping it going and for doing what you do. So Arogya World is the organization I founded. I just want to say what that word means. Rog in Sanskrit means disease, and Arog means without disease. So this means we as an organization, our name is aligned with our mission. We wish the world to be free of disease. Okay, that's our fervent wish. I have a few slides. I'm going to try and go through them quickly. The video has communicated, but I wanted to put this project, which is a very important project for us in context of the work we do and in sort of the whole country of India, complex country. So I'm going to share screen and share these slides with you. Okay. So we are a 13-year-old organization. We are US-based and India-based, and we work seamlessly. Nowadays with Zoom, it doesn't matter where you live, you can get a lot of work done. So India is the most populous country on earth. We are now, we've surpassed China. So it's 1.4 billion people who live in India. And what is alarming, truly alarming, is the number of diabetics. There's 100 million diabetics in India, and staggering 136 million who are pre-diabetic, whom we can save. You know, we can change the trajectory of their life and their health if we can get them to be hooked on healthy habits so that they don't get diabetes. Indians get diabetes very young, age 30, even earlier. So the whole, and India is a very young country. I don't know if you all know that the median age in India is 28 years old, 27 point something. So India, 1.4 billion people, half the people are younger than 27 and 28. So it's a very young country. They're all going to become 30 years old. They're all going to start getting diabetes because that's the age of onset of diabetes. So we have to find people, young people, younger than 30, so that we can actually change the trajectory of their health. We did a study many years ago, asked 1,000 women in 10 different countries, including in India. And in India, people told us that 25% of their family income is spent on care of one person with diabetes. So this is all very, very impactful. Once you get diabetes, you get heart disease, you can get stroke, you can get kidney disease, you can get blindness, you can get foot amputation. There are many more serious consequences of diabetes. So it's really important to prevent it. Fortunately, the disease is preventable. 80% of type 2 diabetes and 80% of heart disease can be prevented with 3 lifestyle changes. We must eat right, that is, choose healthier foods, reduce junk food, exercise, and avoid tobacco. And we have a community-based model for prevention in India, and it is showing traction. We call it the doorstep health model. So we take prevention through healthy living to people where they live, learn, and work. So we have a text message program. We use social media to do Maithali. This is the program that we are going to talk a lot about. Healthy Schools is a school program for adolescent, 10, 11, 12-year-old children. And we have a Healthy Workplace program. And last year, we started mobilizing entire cities like Bangalore to do something, getting different pledge makers to commit to improving the health of people. So our focus is on both rural, today, we work all over India, and we are backed by many people, including Together Women Rights. We're very proud to show your logo. And we won, as the video also said, a number of awards, but the one that we're most proud of is something we won last year. It's the United Nations Interagency Task Force and the WHO Special Program on Primary Health Care. So we were in really great company, as you can see. Also, the only government the only other Indian entity that won it was the government of India. So we are, wow, Ministry of Health and Arogya World are in the same award, and so we were very pleased. So the facts were there in the video, but I do want to repeat it. Why is our focus on adolescents so important? We know that 3 out of 4 teens in India do not move enough. There's no physical activity. They're physically inactive. And the other fact is that as much as 10% of India's adolescents are pre-diabetic. They're getting diabetes at age 10, 11, and 35-year-olds. This was the most shocking for me. 35% of India's 10-year-olds have high blood pressure. Imagine their health when they become 20 and they become 25. They're going to get diabetes, not at 30, but at, much earlier than that. So we really have a ticking time bomb, and we must intervene. And there is so much emphasis on this, both in the government and in the NGO sector like us. We can set these children up for a lifetime of health if we intervene at the right time. So we have a schools program which uses games and activities, age appropriate, well-designed games and activities. So the kids are playing, for example, snakes and ladders, and they throw giant dice and they run up and down this flex on the floor. And maybe an apple is a ladder, a bag of chips is a snake. They will never forget that life lesson, all their lives. So at age 11, they're like sponges. So why do we focus so much on healthy eating? Because we know that unhealthy eating is the #1 cause of death. I really want you to think about this, what the food we put into our mouths is the reason we die. If we just change what we eat, we can probably lead a healthier life. So unhealthy eating is the 2/3 of the reason for diabetes. So we focus very much on it. And eating right is hard. The tools in India were very complicated. So look at this. This is the pyramid for adult women, sedentary adult women. It says she must eat 9 times 30 grams of cereal and millets a day. Nobody could tell me what was 270 grams of cereals and millets. So we converted it. We spoke to the US Department of Agriculture and asked them, how did they design this My Plate? It's an extremely powerful communications exercise. Everybody understands it just looking at the picture. So we wanted to create that, and we did for India, showing how much of cooked food a woman must eat at lunch. If we did that, all the rest fell into place. What her husband should eat, what her son and daughter should eat, what she should eat for dinner, everything fell into place. And we are promoting this aggressively to urban women using social media. But we wanted very much to do this for rural girls, because the adolescent girl stage is the most important stage at which any one of us could intervene. If I look at the life course of a woman or a man, the smartest time to intervene and teach somebody the right tools is at that age, or before they get married, at the teenage years, when their bodies are still forming, their habits are still forming. If we can get them to understand why nutrition is important, anemia will go down, the malnutrition that India has so much of will go down, plus our interest in getting them to eat right will also help them, their current families, their future families, and that child who's going to be born to that 16-year-old girl when she gets married. That is very important, because you can break the intergenerational transmission of diabetes by intervening before the woman gets pregnant. So this became very important. We worked with Path and a whole bunch of nutritional advisors to get the technical things right, as well as the communication right. So we did a comic book conversation between sisters, and it made an aspirational thing. Hey, you can be beautiful, you can have lovely hair, you can have beautiful skin if you eat all these local foods. And it's all focuses on local foods, because a lot of this is unaffordable to a number of families. So we wanted it to be local greens, local, you don't have to go buy oranges. You can just use the local gooseberry tree, pluck it and use those. So there's a lot of ethnic and foods as well as local foods that we emphasize in this. It's a really powerful tool. And what you did for us was give us the freedom and the green signal to go take that comic book and make it a full-fledged intervention. We wanted so much to find a way to integrate this comic book into the school program, because we knew the school setting is a very powerful way to reach these girls. So you have given us the funding to build a really strong partnership with MS University Baroda. It's a very good school, university, and with their students, their master students, we are working to deploy this rural My Thali interventions integrated with the schools program. We already have a very robust schools program. So what have we done till now? We have developed 6 questionnaires and collected baseline data. So the number of papers that are going to come out of this is huge, because they've really done a very extensive baseline evaluation of eating habits. So, they've got dietary practices, nutritional status, diet diversity, and the risk profile of all these girls. So because we teach both schools program and Eating Right through My Thali, we will be tracking lots of indicators. And so we've done that, and we have developed the modules, and my team is reviewing them with MS University and figuring out how exactly to stitch it into the schools program. And then next month is the capacity building and training of student educators, peer educators, and teachers, and then the implementation for 6 months, and then evaluation. So this is a work in progress. I don't have results to share with you, but next year we will have results. And I'm really hopeful that even from a public health, pure science perspective, this is going to be of interest to the academic world. Yes, from a social perspective, it's very important because these girls that we picked, it's a randomized cluster trial. And the girls we have picked are from 2 regions. One is rural Baroda, so just outside Baroda town. The Baroda town is in Gujarat state, and it's in the west of India. So we chose one district, one area outside the city, but we chose another one called Narmada, which is a aspirational district. The government of India has called some of these districts aspirational because their indicators are so low, their socioeconomic indicators are so low. And we believe that by choosing and doing this and showing its effectiveness, hopefully its effectiveness in both sets of girls, we will actually be able to say, okay, we're confident My Thali can change the eating habits of girls, even in very poor households. And therefore, let's scale it up. Dear Gujarat government first, and then all the state governments. So that's the hope. And we are on our way to getting 50, 60, 80 million people educated on healthy eating. And this program is key for reaching the girls who matter and the communities who matter, because urban women and urban men can get that education, but these girls, they don't know. They may have cows in their house, but they didn't know they have to drink a glass of milk every day. So there's a lot of education we can provide, and we are really looking forward to the deployment of this program. So thank you for your support. So non-communicable diseases like diabetes are a big challenge in India, no doubt, but we've accepted the challenge. Thank you.
Thank you. And I have some questions. There are some questions in the chat. And if y'all have questions and haven't entered them, please do. Let's see. What is the connection between tobacco use and diabetes?
So if you are a smoker and use tobacco, the consequences of diabetes are worse. So your heart disease risk is higher. So one of the best things you can do in life is stop smoking. And in India, it's not just smoking, it's also chewable tobacco. So we have to educate people about not smoking, not cigarettes, not bidis, because they use those rolled up tobacco leaves, the homemade bidis, they are not regulated. So you have no idea how much nicotine is there in each bidi. So we say don't smoke to children as well as to adults. But we have this healthy workplace program where we screen. You will not believe, this may not happen in America, but the company will look at backpacks of the factory workers to make sure they are not bringing in chewable tobacco into the office, into the factory. So chewable tobacco is a bigger problem than smoking in India.
Thanks. How supportive of your organization is the government? And this,
Yeah, so it's a really good question. So, India is one of the countries where non-communicable diseases are on their radar screen. They were the first country, as soon as the UN high-level meeting, they declared, we are going to do this right. We're going to tackle NCDs. It's a complex country, right? The eating habits are so different. I forgot to mention that. Even just something like vegetarian and non-vegetarian is so different from different parts of India. And there is rice-based meals and chapati-based meals. And there's a lot, it's very complex culturally as well as eating. So many ways it's very complex. But the government said, we have to do something. So they are actively screening for early detection of diabetes and hypertension. Those are the 2 things they focused on right now. What we would, and we have started talking to some governments. We were a little afraid of the state governments to be, in fact, India is, it's not a central government or federal government, it's a state level. Health is a state subject. So if the state government wants, they can do the health program. So we have started talking to a few governments now, and our school program, for example, is aligned with the national school health curriculum. It's called Ayushman Bharat School Health Curriculum. So we try very hard to tell the government, look, we are towing your line, you set the tone, we'll do it. At the moment, we are very, very eager to use the government's tech backbone to do a lot. You know, we have this ambition of reaching millions, but we don't have the ability to raise millions of dollars. So we know we can't pay for all that text messaging or for a lot of this programming. So it would be nice if it can get integrated. We are working towards that, both in Delhi and in Uttar Pradesh and in West Bengal, 6 districts of West Bengal, all government school children are seeing our program. So once this My Thali tool is ready, all school children will see the My Thali tool as well.
Great. How prevalent is sugar in the diet of teen girls in rural India?
So, you know, Indians do eat a lot of refined sugar. I don't know if you have been to India. Those who have been will see that, you know, people will take a cup of tea multiple times a day, and that tea is very sweetened. They will take several packets of sugar in the tea. In rural India, also, you know, the girls grow up, they drink tea, and they grow up in the household. So the sugar consumption is high. Plus, the other thing is Indians celebrate every single festival by distributing sweets. Any good news, it could be a promotion, or it could be a new child, or the wedding, or an engagement, or some 20 different festivals are celebrated. All of them, you distribute sweets to everybody. So I bet to you, the girl growing up, even in a very poor household, even in, you know, rural India, will be eating as many sweets as her urban counterparts, only because it's so culturally ingrained. But what we spoke to mothers and their daughters when we developed this My Thali tool for girls, and they told us, look, we didn't know, we don't know half the things you're telling us. If we knew, we would do it. We just don't know. It's affordability is one thing, but knowledge and awareness is another. So sugar, getting Indian girls to quit sugar has to start with a very structured program like ours, where we are, you know, formally going about it step by step. So,
And as a follow-up to that, what can be substituted for sugar in the diet of teen girls who can't afford the price of sugar?
yeah, we actually, you know, we sometimes will have them, we suggest jaggery, which is unrefined sugar. It's still sweet, but better. We also ask people to make desserts out of fruit, you know, the dates and the sweet fruits. And we ask them to have fruits. Indians don't eat a lot of fresh fruit. One, it's difficult to afford. And second, it is not part of the habit. In America, we eat fruit as a snack so often, and it is not a snack. A fried something is considered a snack, but a fruit is not. So we push with all our programming and messaging. We push fruits as snacks with a handful of nuts. That's what we push a lot to the girls. So I think slowly, if the family decides to reduce sugar, so the government of India has a really powerful ad which says just a little less. It says, aaj se thoda kam. So just a little less from today. Not stop. We're not asking you to stop. If you're supposed to eat 1 laddu, eat half today or 3/4 today. Next day, a little less. So eat, but eat less. You know, put less sugar in your tea. So it's just it's an education. It's something we have to work on. Salt is worse. Sugar is probably a bit easier to quit than salt.
Thank you. Barb, I'll hand it back over to you.
Barbara,
Barb, you're on mute.
So sorry. Thank you again. This is, we are so proud to support the important work that you do. And it's just a wonderful program, and thank you.
thank you so much. We look forward to sharing our progress and results with you guys. And again, thank you for your wonderful mission and the way you are executing it. Thank you.
The next part of our webinar is Where Are They Now? Feature. I love this part. As part of our 20th anniversary, we're looking back at some of our past grantees. Tonight, we're thrilled to get an update from Girls Determined in Myanmar. Girls Determined received a featured grant in 2012 and a sustained grant in 2016 through 2018. Girls Determined works to promote girls' rights by organizing colorful girls' circles, training facilitators, creating curriculum, and bringing girls together on exposing the reality of girls' lives in Myanmar. We're pleased to have Alita Phelps with us tonight. She is the Program Quality and Communications Officer with Girl Determined. Alita has been working with Girl Determined to advance the rights of adolescent girls in Myanmar since 2017. With Girl Determined, she has held various roles, including grants management, donor relations, and program quality advising. She has collaborated with the leadership team to secure funding for girls' leadership programming that impacts over 3,000 adolescent girls annually across the country and 100+ women facilitating these programs. Originally hailing from a small town in Alaska, she has spent many years living abroad, applying her MSc degree in international development and working with young people to build creative, healthy, confident attitudes towards their own lives. Welcome.
Thank you, Barbara.
You're welcome.
All right, so I'll take it from here then.
Okay.
Yeah, thank you all for inviting us as a past grantee to come and speak. It's really a pleasure to be here. So we'll see if I can follow up from Nalini's wonderful presentation. I'm going to try to share my screen as well so I can give you something interesting to look at while I tell you about what we do. And all right, is that clear?
Mm-hmm.
Okay, super. Okay, so yeah, my name is Alita Phelps and I've been working with Girl Determined since 2017. We are a Burma-based leadership project designed to facilitate girls' recognition of their personal and group potential, as Barbara already mentioned. We believe that we are sparking a movement of girls with leadership skills to advocate for their own rights and a future that does not recreate the risks that they now face. So just a little bit to give you some context of Burma, also known as Myanmar, located in Southeast Asia, borders Thailand, Laos, China, India, and Bangladesh. In Myanmar, there's a high rate of poverty, there's a weak rule of law, and there's a history of human rights abuses. Most of the people work in agriculture. The majority of the population is Bamar Buddhist, although there is also a rich, diverse range of ethnic groups that exist in the country. So we focus, as well as many news organizations, specifically on adolescent girls. So some of the issues that girls in Burma face are ethnic and religious tension, strict gender role norms, poverty, school dropout, dangerous labor and trafficking, violence, and early marriage. And since we kind of think of it as like a double crisis, since the COVID pandemic and the military coup in 2021, a lot of these issues have been significantly exacerbated, and we're seeing opportunities shrink for young people, especially for girls. So our organization was co-founded by Brooke Zobrist. Unfortunately, was unable to be here tonight, which is why I'm speaking on behalf of Girl Determined, and her counterpart, Nanda Min. In 2010, they met with adolescent girls around the outskirts of Rangoon, which is the commercial capital of Myanmar, to listen to girls' concerns and what girls themselves said that they wanted and needed. So our foundational Colorful Girls Circles programs grew out of these initial gatherings with girls. So this is a picture of Brooke with quite a large circle of girls in one of their initial meetings. The strategy that we have is one that's three-pronged. We use individual transformation, as well as group mobilization and research and advocacy. Through this transformative approach, we work with and for adolescent girls to develop their skills and confidence so that they can advocate for their own rights, navigate instability, and reach their fullest individual and group potential. And so, yeah, so this is our main program that everything else kind of builds off of. It's called Colorful Girls Circles. Colorful Girls is what the girls themselves decided they wanted to call it back in the day when it started. It's for adolescent girls aged 12 to 17, although we have gone a little bit higher and younger just due to the situations in different communities. It was designed to be a 2-year after-school peer processing group. It has a creative and activity-based curriculum, and it's led by local women who we train and who are familiar with the community, familiar with the girls, and that's the best way that it's worked so far. This kind of structure is our main way of operating. However, again, because of the crisis in the past few years, we have had to adapt to the situation, and we haven't had school for a couple of years, so it was not a school after school program, but it kind of in some ways replaced school, and the girls didn't have a whole lot else to do. So in some ways we had certain more amounts of opportunities and time to work with girls, but it was just, yeah, it was interesting adapting. The girls that we work with are typically marginalized, living in rural and peri-urban areas, and they are diverse in ethnic and religious backgrounds. So this is our kind of secondary program, sports, which we try to pair with our circles everywhere we can. Again, very play-based. We focus on volleyball because it's a team sport. It's kind of easy to get in. We don't have to fight with the boys at the soccer pitch. Again, it's led by trained community women, building pathways for girls. We're challenging gendered norms, promoting body positivity, and prioritizing physical as well as mental well-being for girls through sports. And then a couple of the other things that we do, again, branching off of our foundational, more or less 2-year circle program, is the Peace Building Summer Camp. This is around 100 girls that we invite who have to apply and be nominated by their peers. And we try to select the girls to get as diverse of a group that we can so that they meet other girls from different backgrounds who speak different languages, come from different areas. And it's a really kind of exciting week-long experience that they get to take home, and pretty special for a lot of them. Let's see. Another thing that we have tried to build out, which we're shifting at the moment, but is our girl-led media projects. This is an example of this like actual handmade magazine that our girls media team created. They were doing this 3 times a year throughout the year. We had thousands of copies that they were printing and giving to other girls. In the magazine were stories, poems, artwork, information specifically by the girls and for the girls. Yeah, so that's pretty fun. We've also had to build out our safety and security protocols and systems again, which I'll mention again in a minute. We've built our own internal identification system so that we can monitor girls' situation, their development, and their safety. Working with children, of course, this has to be a huge priority for us. And we hear a lot of situations for girls about violence and and issues around safety. So we've developed like a phone hotline, which girls can call and talk to trained phone receivers to report crises or ask questions or seek information about reproductive health, anything they want. So just wanted to mention that, yes, Standing for Women, which is now Together Women Rise, was a significant supporter for us. And it was interesting looking back on just how long we received support from Standing for Women from 2013 to 2019, which is incredible. As they mentioned already, there was some initial funding and then the sustained grant, and this kind of flexible funding really helped us build our organization as well as our programs up during some critical time for us. We were just getting going at, I think, the first initial connection with Standing for Women, and have since just kind of exponentially grown in terms of reach of girls, in terms of our leadership and our organizational capacity. So it was significant for us. We were able to build out our Circles curriculum to a full 2-year program. And during this, we did as best we could to remain focused on the actual needs of girls and keep listening to them and involving them in each step of the way. Yeah. So today, we are engaging with over 80 communities in 6 regions and states. We have around 3,000 adolescent girls currently enrolled in our programs. And since our beginning, if my numbers are correct, we have about 16,000 girls who we have reached across the country, which we're quite proud of. And that's our network. So we still stay in touch with a lot of the girls. Some of them have come back to work with us, are working on a magazine projects, are doing certain kind of learning and working opportunities with us. And over 180 women staff are working with us, mostly community-based. So that's also, yeah, we're pretty proud of that. I won't touch too much on our impact, but we have a significant research and advocacy way that we work to measure our impact, and we measure leadership, on awareness of gender-based violence, awareness of sexual and reproductive health, financial literacy and economic empowerment, and we have seen gains in all of these areas, significant gains. And this is for the girls who do the 2-year program, the 2-year Circles program. In the community, girls are now leading projects themselves. Some of these include sports clubs, community health and safety initiatives, meetings with community leaders, and parents and teachers themselves are reporting positive changes on girls' capacity, what they're seeing girls up and do, which is quite surprising. And we have also been able to be involved with drafting policy on violence against women in the country when we were at a point where we could do that. At the moment, we are not so able to influence policy because of the situation in the country is quite unstable at the moment. So, but we're working in other ways to partner with other organizations and continue our work. So I think that's all that I have to share. Thank you for your attention. And I wanted to just we have a website because of the situation in Myanmar has been quite insecure for the past couple of years. We don't have much on our website. So we've taken it down for safety concerns for individuals and the organization itself, but feel free to reach out to us at the email listed there.
Thanks, Alida. We have some questions. So the first one is, did Together Women Rise's grants help you attract more funding?
I mean, I think definitely, because at least in the way that it enabled us to keep doing our work and expand. And the more that we expanded, the more we could demonstrate our capacity and our ability to handle how we were expanding. So it absolutely has. Yeah, we have a range of funding from small institutional funding to family foundations to the occasional like government grant, but we try not to take on too many at once because it's only myself and Brooke that really do the grants management side of things. As you all know, probably it's a lot of work managing these, but yes, it has definitely helped us grow and demonstrate reputability, I would say.
Great. And the next question is how are parents involved in the safety project? And is there partnership with the authorities?
Yeah, that's a great question. So we work through the communities. We work in 80+ communities, and we don't just come in and say, hey, girls, come talk to us, and like don't talk to any of the other community leaders and the parents. We do some initial scoping and outreach in a community before we start, just to assess whether they, how they can support us, whether they can support us, whether they can give us a place to meet, whether they agree with, you know, what we're bringing in, leadership for girls, boards, if where possible. And of course, we get parental or supervisory permissions for the girls to participate. And yeah, and the girl-led projects are really kind of a cool thing where the girls actually themselves lead it and they invite their parents and they tell them what they're doing, and then they can engage the communities themselves.
Awesome. Let's see. How has RISE helped in the midst of the coup, and what is the status of instability?
Right. RISE is a reference to the organization Together Women Rise.
I think so, yes.
Okay. Well, like I think, yeah, so we received grant funding up until 2019, so that would have been pre-coup, but I mean, I think we still have some connections. The instability is still very much an issue. It's been over 2 years now since the coup, and it has been devastating for the population, and it's really fractured a lot of communities and is continuing to, you know, create fear and uncertainty amongst people. And it's really hard, especially for young people who are the ones who are really resisting this, to kind of keep hope and know what's going to happen next. Can things return to how they were pre-coup, when there was semi-democracy happening? You know, a lot of young people are just like either they're definitely not ready to give up, but they either have to make it work where they are, which is what we're trying to work with girls on now, is you can still do things in your community and we're here to support you. And a lot of young people are actually, well, what they call the brain drain. A lot of young people who want to seek further education are leaving the country, sadly. And some are fleeing for their lives. So it'll be interesting to see what's going to happen. We don't, you know, it's hard to predict, but like we're one of the few organizations that is still remaining in country, and, you know, we're doing so quietly. And that's just how you have to do. But hopefully the girls will, in their own time, get what they want.
Great, thank you. And I'll turn it over to you, Barb, but also note that there are some comments that you might want to read
Okay.
about folks who have visited. Yeah.
Yeah,
Okay,
we have three participants on the call tonight that have been to Myanmar and visited your program. So it was great that
Fantastic.
you were here to update them. I want to thank you so much for joining us, Alita, tonight and updating us with your the Girl Determines work.
Yeah, thank you.
You're welcome.
Thanks. It's great to see some people who know and came on that trip. Brooke still talks about it.
That's great. So Together Women Rise depends on your donations to fund projects like the ones we've learned about tonight, and as well as all of our education and engagement activities. So you can visit our website to learn more about Together Women Rise at togetherwomenrise.org to support our mission. And I have some upcoming events I will throw in here right away. August 15th, Together Women Rise Advocacy Group with Results will be meeting. On August 28th, 30th, and 31st, we will host a series of information sessions for prospective grantees to learn about our grant application process. So if you're interested in that process, that would be great to attend. We have a full calendar of events for our 20th anniversary, so visit our website for all of these dates and details. And our book group meets on Wednesday, September 20th, and the book this time is Girls in the Wild Fig Tree, How I Fought to Save Myself, My Sister, and Thousands of Girls Worldwide by, I hope I'm saying this right, I think it's Nice Longette. So you have a little bit of time to read that book and join us for the book group if that's something that you're interested in. And you can find all of, our next monthly webinar is on Thursday, September 7th at 8 p.m. Eastern, 5 p.m. Pacific time. So we hope to see you guys again. And you can find all of this information, click on the Join Us tab and then upcoming events, and they'll all be listed for you. And you'll be able to register for the events there as well and access recordings of past events. So thank you, everybody.
Barb, before we go, we've got an upcoming 20th anniversary in Chicago. So
Oh, yes.
does Vicky want to say anything? Because registration is open. It's going to be an awesome event.
Thank you, Colleen. We are actually, one of our presenters is a young woman who's originally from India, and she's going to lead us in a musical tour around India, and we'll get up and move and dance a little bit. And
wonderful.
Yeah. So.
And what is the date of that?
September. We're starting Friday night with the reception, but the main stuff is Saturday afternoon, September 30th. So.
Wonderful.
But before then, come to Denver, September 9th.
Go Betty, go Betty.
Yes.
Beautiful time of the year to be in both places. So lots of fun planned for everybody. Thank you, guys.
Yes.
Well, thank you all, and good night, everyone.
Good night.
Good night.
Good night. Thank you.